Good morning or good afternoon, everyone. Thank you for joining us at Husch Blackwell for our discussion today in a webinar on the CMS, Centers for Medicare and Medicaid Services, Interim Final Rule regarding vaccines and the need for vaccines in specific healthcare entities. My name is Tom O'Day. I'm an attorney in our Wisconsin offices of Husch Blackwell, here in Madison, Wisconsin, where earlier today it was, believe it or not, snowing. I'm here with Jessica Brown from our Phoenix offices in Arizona, and Carrie Claiborne from our Wisconsin offices may be joining us as well. Before we begin, just a couple housekeeping items. At the bottom of your audience console, there are multiple application icons for your use during the program today. If you have any questions, specifically for any of the presenters during the webcast, you can use that Q&A icon to submit. And we can see those questions as they roll in. There's a couple already there, so thank you for them. We will try to answer all questions during the webcast today, but a fuller answer may be needed, and we're happy to follow up with you afterwards if you reach out. I'll note that in these webinars in the past, we've had literally hundreds of questions come in, but we'll try and address them and categorize them as we can. A PDF of the presentation slides today is available in the resources folder in your console. The program is pending approval for legal education hours, and to report your hours, click on the CEU icon at the bottom of the screen. A certificate of attendance, including course numbers, will be emailed to you tomorrow, along with a recording of the webcast for watching and sharing. Toward the end of the webinar, we'll ask you to complete a short survey. We'll use your feedback to plan future programs that are applicable to your business needs. So that's all for housekeeping items. We would appreciate your feedback on the survey, and at the end of today, we'll mention a couple other webinars that we have coming up in the future, so we'll use that feedback for future webinars. So as I mentioned, joining me today is Jessica Brown. Jessica focuses her practice on labor and employment matters, partnering with clients to develop solutions to workforce challenges. Again, my name is Tom O'Day, and I represent employers through sophisticated labor and employment issues, primarily in the healthcare industry and workspace, but across all industries as well. So again, thank you for joining us, and I'll turn it over to Jessica.
Good afternoon, everyone. We are going to go over the agenda briefly, and we have added one item to this agenda. First, we'll discuss the scope of the rule, which facilities are covered, and which workers are covered by this rule. Next, we're going to discuss the nuts and bolts, the requirements of the rule. Then we will go over the exceptions and what is not required under this rule. And then the item that we've added to the agenda is we're going to discuss enforcement and penalties for noncompliance. Next, we will discuss the interplay with the federal contractor rules and the recent federal other vaccine mandates that you are probably aware of. And we will close with touching on state law issues and other legal challenges to these vaccine mandates. Our first topic is the scope of the rule, which is surprisingly a bit more complicated than it should be, but it applies to 21 Medicare and Medicaid certified provider and supplier types that are regulated under the Medicare health and safety standards. And it's quite broad in scope. The next slide lists the 21 types of facilities that are covered under this rule, and I will spare you from having me read this entire list, but you have this slide for your notes. Okay. The rule does not apply to any healthcare service that is not regulated by CMS. This includes physician offices, dental offices, assisted living facilities, and the other facilities that are listed here on this slide. If you are not subject to CMS's safety regulations, you are not covered by this rule, though you may be covered by another one of the federal vaccine rules that we will touch on at the end of this presentation. Okay, who is covered? All staff working at a covered facility must be vaccinated under this rule. This includes clinical and non-clinical staff, and it is not limited to patient-facing staff. The rule is intended to be quite broad, and it covers employees, licensed practitioners, students, trainees, volunteers, and physicians with admitting privileges at any of the covered facilities. It does not cover 100% remote workers. So those would be telehealth providers, payroll processors that do not work in covered facilities. They are not required to be vaccinated under this mandate. There is another category of workers that it's a bit tricky, and we have been guiding employers through this over the past week, trying to discern who fits into this bucket. And that is staff who provide support services for the facility that are performed exclusively outside of the facility setting and who do not have any direct contact with patients or with other staff who interact with patients. In this category, corporate workers may fall into this if they are in a building that is completely isolated from one of the covered facilities. And if those staff do not interact with staff who interact with patients, they may be exempt from this. But we do encourage you to consult counsel if you have any questions about whether your staff are covered under this rule, because this is a bit of a gray area and sort of a tricky category to navigate.
And Jessica, one quick note there, because I see a couple questions related to this. And I'd say the general rule of thumb is if you, as an employee, are interacting with anyone else who might be in one of these covered facilities, then you are yourself covered by this rule. And so one of the questions is related to durable medical equipment suppliers at the point of service. So if you're going into a home residence or a facility as a durable medical provider, you are covered by this rule. If someone had a question about board members, if you've got a nursing home or some other medical facility that has a volunteer board of directors, you are likely covered by this rule unless you are totally kind of carved out from any contact with individuals who might walk through those doors of the facility. So it's really that rule of thumb. If you are going to touch a person who's walking through that the doors of that facility, then those individual employees are likely covered.
That's a very helpful description. So we have staff who work off-site in non-clinical settings. This is another tricky category. They are subject to this rule, including those who work in admin offices. And this is what Tom mentioned, as long as they interact with patients, residents, clients, or PACE program participants, or staff who interact with patients. So that's that like twice removed category, which is a little tricky, but the rule is intended to be broad. Okay, what is required? So now we are going to go over the nuts and bolts of this rule. The first deadline is coming up, December 5th. All covered workers must receive their first shot of a 2-dose vaccine or the single shot of the J&J vaccine by December 5th or request an exemption. And by January 4th, 2022, all covered workers must have received both doses of a 2-dose vaccine or have received an approved exemption. And any vaccine listed by the World Health Organization for emergency use is acceptable, even if it is a vaccine that is not FDA authorized. Facilities are required by December 5th, 2021 to implement policies and procedures for a COVID-19 vaccine program, ensuring all their covered staff are vaccinated or receive an exemption. So if you have any questions about putting a policy in place, our firm has a tool called a policy generator tool where we have been, for a reasonable flat fee, helping employers get into place these compliant policies to meet this deadline. So we'd be happy to help with that if you have any questions about what type of policy you need to have in place by December 5th.
One note too on that slide, and there was a question that I see here and that we've had a couple times. The requirement for exemptions before that December 5th deadline is that the exemption request is made. You don't yet have to grant all exemptions by December 5th, but the request needs to be made. You will have then until January 4th to actually determine and decide on those exemption requests.
That's right. And I believe a question was asked right when we started about whether there is a test out option of this vaccine mandate. And Tom will touch on this later in the presentation, but unlike the OSHA ETS that was just issued last week for large private employers, there is no automatic testing out option under this rule. Testing may be an accommodation, part of an accommodation that's granted, but it is not, there's not the option to opt out of vaccination and test. Okay, acceptable proof. So the type of proof most of you are probably familiar with is the CDC COVID-19 vaccination record card. That, of course, is acceptable, or a photo of that card. Also, a documentation from a licensed healthcare provider, or an electronic health record, or state immunization system record. All of these are acceptable proof of vaccination that your covered workers can provide. Also, if they were vaccinated outside of the United States, a reasonable equivalent of one of these types of proof will be acceptable. The facilities are required under this rule to track vaccination status of all covered staff and to maintain proof of vaccination status as confidential medical records that are kept separate from the employee's personnel file. We also encourage you to consider HIPAA requirements. They may come into play when you are accessing medical records or if there's any disclosure to third parties. And now I will turn it over to Tom to discuss paid time off.
Great. Thank you. So one of the things that you need to keep in mind, and we'll touch on what is an unbelievable web of coverage under all these different rules, but for most healthcare entities that are covered by the CMS rule, not all of them, but most of them, you are also still covered by that OSHA emergency temporary standard that came out in June of this year. That June OSHA emergency temporary standard did not require vaccination, but it did require things like physical barriers and social distancing and masking and screening on the way into the facilities. Those rules all continue to apply to those entities that were covered by that June OSHA rule. One thing the new CMS vaccine mandate does not require is paid time off for employees to get the vaccine, to recover from side effects from the vaccine, or any other reason. It's not required by the CMS rule, but you've got to keep that June OSHA emergency temporary standard in mind if you're covered by that. Because that June OSHA emergency temporary standard does require you to provide that paid time off for the employees to get the vaccine and to recover from any side effects of that vaccine. Specifically, just reasonable. Whatever reasonable time an employee needs to recover from getting the vaccine is something that you need to provide paid time off. You also need to keep in mind Fair Labor Standards Act and state equivalent laws about what is and is not considered compensable work time. If you've got the employee who comes in, starts their shift, and then they've got a 10 a.m. Appointment for their first shot of the vaccine on site, you've probably got to pay them for that time that they're receiving that vaccine shot while they're on site between their job duties. Keep in mind state law considerations as well. One thing to keep in mind as well is exempt employees, and as you treat exempt employees with respect to wage and hour laws, you want to make sure that you're not making deductions from their time or doing things that might jeopardize the fact that they are exempt from overtime rules and regulations. You have to keep in mind individual state laws as well. There may be individual state laws that require an employer to pay for medical examinations or testing that's related or a condition of employment. So those individual state laws are something that you're going to need to navigate as well as you consider whether or not you pay for time off for things related to the vaccine. And then just keep in mind employee relations. There may not be an obligation to provide paid time off for things like side effects from the vaccine, but it may be in your best interest to do more than the law requires and provide those employees with what could be considered that extra benefit. So the requirements themselves, and a couple of the questions that I saw earlier, and just for your purposes in the audience, there are now over, I think, 50 questions. So they're piling up. We're not going to be able to get to all of them, but we are watching them, and we'll try and sprinkle them in throughout. I know some of the questions were related to what do we need to do by December 5th. The exemption request needs to be made. It doesn't need to be granted or denied by December 5th. That grant or denial date is January 4th. You do have to have the written policies in place by December 5th. And it's important to remember that these written policies don't just apply to your W-2 employees. They apply to everyone that's covered by the rule. So the staff that come on site as locums or as medical directors that are contracted, or physician groups that you contract with to come into your medical facility, need to be covered by these kinds of written policies. It's not just employees. These policies are not something that you probably want to put in an employee handbook, because you don't want, nor should your employee handbook apply to people who are not your employees. Keep in mind that you, as the healthcare entity that's covered, have the obligation to track the exemption requests and to track the vaccination status of all of these employees and non-employees coming on site. So a lot of the questions that we're seeing in the chat are asking about your vendors or your suppliers or your partners in care. It's probably best practice for you as the covered healthcare entity to track those yourself. There have been a lot of healthcare entities that have implemented their vaccine requirements as a voluntary process. You weren't required to do it under federal law prior to this. And one of the biggest struggles is those relationships with your physician groups that come on site, your staff that comes on site that's not employed. Now that we have the rule, now that the obligations are put on the healthcare facility itself, it's probably best practice for you to do the tracking. If you're a hospital that has physician groups coming on site, it's probably best practice for you to have them fill out your exemption forms for religious or disability or medical exemptions, and for you at that hospital to start making some of those kinds of decisions. The other thing to keep in mind is your policies with respect to safety precautions. You still have an obligation as a healthcare entity under CMS to make sure that it is a safe and healthy work environment and also patient care environment. And CMS requires you to have a policy articulating what that looks like. I tell you, for those of you covered by the June OSHA ETS, the physical barriers, the social distancing, the masking, the screening, those are the kinds of things that CMS is going to be looking for in your policies and procedures. It's not a surprise. It's nothing different than what you do. You probably already have all of those things in written policy, but CMS now is going to come on site and look for those as well. Another note with respect to this, like Jessica said, the CMS rule is a hard mandate. There is no option for just testing. But I tell you, I think CMS is probably going to be looking for testing requirements for those employees who are not vaccinated. So if they have a religious or a disability exemption, I think CMS probably expects, as part of reasonable safety precautions, that there is some level of testing. It doesn't necessarily need to be daily, certainly, maybe not even weekly. Maybe it's every other week, or maybe once a month, or you require the employees to do it at home and attest to the fact that they've taken that test at home. But testing isn't required. But I tell you, in order to maintain a safe patient safety location, you may want to have that requirement as part of these policies. All right, Jessica, I'll turn it back to you.
All right.
Oh, you know what? I take that back. These are mine. Sorry, these are mine. I apologize. So these, I'm going to keep moving forward. So I mentioned the exemptions, the Title VII religious exemptions, the Americans with Disability exemptions as well. I'd say there are really no surprises in the CMS rule related to the exemptions. There are federal laws that require you as an employer to accommodate an employee with a sincerely held religious belief. And there are federal laws that require you to accommodate an employee with a disability. A bunch of the questions that were in the chat and the question and answer tool relate to pregnancy. nursing mothers, or employees who are undergoing infertility treatment. Those employees are generally protected by the Pregnancy Discrimination Act under federal law. And in their rule, in the commentary to the rule, CMS recognized that there may be obligations of an employer to accommodate people under the Pregnancy Discrimination Act. That's a very complicated analysis. I'd encourage you to talk to legal counsel about it. But I tell you, there may be room to allow for pregnant women who have a medical condition, certainly, to get an exemption under the CMS rule, a temporary exemption while they're currently pregnant. For religious exemptions, that's really an opportunity for businesses to make some business decisions about the rule itself. There are federal rules, and there's certainly federal guidance around how you manage an accommodation request related to religion. And I tell you, there's a fair amount of flexibility about doing so. With respect to medical and disability exemptions, the CMS rule did have a little bit of a surprise. You have to provide a disability exemption for sure, but there's specific requirements in the rule that are now related to what you have to get in terms of documentation. You have to have a physician or another medical practitioner practicing within the scope of practice who makes a recommendation, a written recommendation that this employee should be exempt from the requirement to obtain a COVID vaccine. The medical professional also has to indicate which of the COVID vaccines are contraindicated for that employee. So in theory now, you could have an employee who is allergic to one of the three major vaccines available, but they're not necessarily allergic to, nor are the other two vaccines contraindicated for them. And if that's the case, then the CMS rule is assuming that you will, as an employer, have that employee receive one of those other vaccines. So that was somewhat of a surprise that now medical professionals who are writing notes for their employees are going to have to specify which vaccines are contraindicated. And then the last requirement for the disability exemption is that there's some kind of explanation of why, some connection between the need to not obtain the vaccine and whatever the underlying medical condition may be. And I'm sure our question and answer box is blowing up. We know that these exemption questions are difficult and something that you need to manage. We can address those. We have addressed those in other webinars, and we'll point you towards some of those resources and tools that are available at the end of our discussion today. Last one I'll mention here is the concept of delayed vaccinations. So there is language in the rule that touches on employees who have recently had COVID. Natural immunity is not something that CMS recognizes. So to the extent an employee tries to claim that they had COVID last year in July of 2020, they've got antibodies and don't need to be vaccinated, that's not acceptable for purposes of this CMS rule. If an employee has received antibody treatment, convalescent plasma treatment, then there is a period of time that the CDC recommends an individual not get the vaccine. It's 30 days for one type of treatment. It's 90 days for another type of treatment that an individual should wait before they get a COVID vaccine. So that's something that you will need to manage through. What I've recommended to clients is in their communication to employees, they just mention if an employee has recently received antibody treatment, that they should contact Human Resources in order to further discuss what the requirements look like around their obligations. With respect to reasonable accommodations, to the extent that you grant them for religious and/or medical disability purposes, the accommodations aren't necessarily a surprise. It's testing. It may be, certainly wearing a face covering if you're not already required to do so under that June rule. And then you can take other safety precautions like potentially moving employees who aren't vaccinated off-site, or maybe even looking for other opportunities for transfers within the organization so that they may not be, for instance, patient facing. The standards for accommodation are different. We now have a fair amount of clients who are deciding that they may not accommodate a religious exemption to the same degree that they accommodate a medical or disability exemption. The standard for a religious exemption and the obligation to accommodate is anything less than a minimal burden. If a burden pushes past that minimal burden standard, then you're not obligated to make that accommodation for the employee under federal law. There's a very strong argument, and some employers are taking and running with this, that patient safety is prominent, and the vaccines are the best way to protect patients. And to the extent that you have a religious exemption and a request, we might not be able to accommodate that if you're patient facing. It's too great of a burden on us and too great of a threat to those patients. That's one extreme, I'd say, of kind of the continuum. On the other side of the continuum are employers who decide, if you have a sincerely held religious belief, I'm not going to question that, and I'll accommodate that. And it means you have to test, mask, socially distance, whatever your accommodations and other precautions might be. The burden for medical or disability exemptions and the need to accommodate those is higher than the religious exemption. So it's difficult to show that there is an undue burden if you have to provide a medical exemption. I tell you, though, there's our room to argue that patient safety is something you can't compromise. And I know, there are employers out there who are taking the approach of, in a patient-facing role, we can't even accommodate a medical or disability exemption because that unvaccinated status is too great, something we can't allow. A lot of questions have to do with the payment for the cost of testing. If you are covered by the June OSHA ETS, the emergency temporary standard from June, you have to pay for that COVID testing anyway. That June OSHA standard is going to expire, almost certainly going to expire on roughly December 21st of this year. At that time, employers may decide, who are covered by that June OSHA ETS, or employers who aren't covered by that may decide, we don't want to pay for testing. We'll require it as a safety precaution, but we don't want to pay for it. A couple things to keep in mind. One is state law. You have to make sure your state allows you to force that cost of the test on the employee. The other consideration is with respect to these accommodations. If you have an employee who can't get a vaccine because of a religious objection, a sincerely held religious belief, there's an argument to be made that you can say to that employee, the cost of your testing that we're going to require of you is too great, and it's more than a minimal burden, and you, employee, have to pay for that test. There's a risk there, but that's potentially an option for you. With respect to the cost, making an employee pay for the cost of a COVID test with a medical or disability exemption, it's harder to do because, again, that burden, that standard for showing an undue burden is higher than a religious exemption. I'd say probably not. You probably can't have those employees with medical or disability exemptions paying for the cost of the COVID tests, just because the cost of the COVID tests are still relatively significant. Now, if you decided to do rapid tests, or if you decided that those employees with medical or disability exemptions need to attest to the fact that they have taken a test at home, maybe there's room to say that's something we can force on the employee and require them to pay for those costs. Highly complicated. I'd advise you to talk to your counsel and those in whom you have trust about managing through all these different considerations. The other thing to keep in mind is we very well may get more guidance through frequently asked questions or otherwise from CMS, from the Equal Employment Opportunity Commission, and other agencies that have some enforcement aspect related to these kinds of considerations. Now, with that, Jesse, I think we're at a point where I turn it over to you.
All right. Hopefully this next section, enforcement and penalties for noncompliance, will address a few of the questions I've seen in the chat. Okay, let's see here. So as we've discussed, December 5th is our first deadline. Staff who fail to comply with the deadline by either they haven't gotten any dose of either vaccine or they have not requested an exemption are prohibited from providing any care, treatment, or other services for the facility or its patients. Additionally, by the hard next deadline, January 4th, if they have not obtained their second dose of a 2-dose vaccine or obtain an approved exemption by January 4th, they are prohibited from providing any care, treatment, or other services for the facility or its patients. So what are your options if you have employees who are refusing to comply? Well, they, as we know, cannot provide patient care. They may be transferred to other roles that do not involve patient contact or interaction with staff who have patient contact. If there are remote positions available, that would fall under that bucket. They could be offered a remote position. They also may be suspended without pay until they become compliant. And you could include with any kind of suspension materials, trying to educate them on the vaccine. I mean, if you're at this point with an employee in this situation, they may not be very responsive to efforts to educate them about the vaccine, but that is an option, is to try to educate them about it. And finally, you are able to terminate their employment if they refuse to comply. I know that's a really tricky and difficult situation because there are a lot of staff shortages right now. But these are some of the options. The one thing to keep in mind is, as some people have asked in the chat, they cannot provide patient care if they are not compliant. And for those partially vaccinated, oh, go ahead, Tom. Well, there's that window between December 5th and January 4th. And what do we do about people who've requested an exemption but haven't received one yet, or they have gotten the first shot but not the second shot? In those instances, my recommendation would be, and CMS says that the facilities have to have measures in place to, protect patients as much as possible from transmission. That's going to be a case-by-case basis, depending on the employee and their role. Certainly testing, masking, social distancing, if it's possible, those are all options. Screening for symptoms, excluding them from the workplace if they have any symptoms of COVID, especially until they obtain a negative test. Those are options for that interim period between December 5th and January 4th. But Tom, were you going to add something to that?
No, that was it. And that you are going to have that interim period of people who are not vaccinated, don't have a shot in the arm, but have an exemption request pending, where they may be able to provide that patient care until just January 4th.
Okay, enforcement. So the deadline for enforcement is January 4th. We'll see how quickly they start enforcing, but that's the hard deadline. So state survey agencies will conduct on-site compliance reviews to assess compliance during the standard recertification surveys. And on all complaint surveys, state survey agencies will assess a vaccination status of all staff. Additionally, while on site, the state surveyors will review the facility's COVID-19 vaccination policies and procedures, so those written plans. They're the policies for tracking vaccination status, how vaccination records are stored, things like that. The number of resident and staff COVID-19 cases over the last 4 weeks is another factor they're going to consider when doing these surveys. And a list of all staff and their vaccination status will be reviewed. Also, accrediting organizations will be required to update their survey processes to assess facilities that they accredit to ensure they are compliant with the IFR. Penalties for noncompliance. These range from civil monetary penalties, denial of payment, and then the ultimate penalty, which is a last resort, is termination from the Medicare and Medicaid program. that no facility, the CMS has said no facility will be terminated without having an opportunity to correct their deficiencies. So state surveyors will cite non-compliant facilities based on the severity of non-compliance. And these fall into three categories: standard, condition, and immediate jeopardy. The standard citation is for minor non-compliance, and CMS will issue a plan of correction, letting the facility know they need to correct some deficiencies to come into compliance. And CMS has said that it intends for these standard citations to be issued to facilities where almost all covered staff are vaccinated, but not all. The facility has a reasonable policy in place. The facility is educating its staff on vaccinations, and the facility has procedures for tracking and monitoring vaccination rates. So the facility is pretty compliant in this instance, but can still be subject to this standard citation if they don't have all of their staff vaccinated by the deadlines. CMS has said if a standard citation is issued, a facility will still be able to continue operating, but they will have to come into compliance with the plan of correction. The next level of citation, a condition level citation, is for substantial noncompliance. And unfortunately, we don't have a lot of guidance on when this type of citation may be issued, but we know it is likely to come before the immediate jeopardy citation. The immediate jeopardy citation is for serious noncompliance, and that is a failure of the facility to fix prior deficiencies. So if the facility has previously received a standard citation or condition citation and has not remedied those deficiencies, they may be subject to this. Also, if the surveyor observes substantial interaction between unvaccinated staff and patients, that is one of the factors where the facility may be subject to this immediate jeopardy citation. And if a facility receives an immediate jeopardy citation, they will have 23 days to remedy the deficiencies to avoid termination from the Medicaid and Medicare program. So scary, but everybody will get warnings before this, so we don't have to worry too much about the immediate jeopardy, because we will have a chance to come into compliance before that, though there may be civil monetary penalties before that happens. All right, now Tom is going to discuss the web, as he mentioned, of all the other vaccine mandates and rules out there and how it interacts with the CMS rule.
Yeah, and in my mind, it's, you know, there's that the movie Beautiful Mind with Russell Crowe, I think it was, where there's all those like numbers and things moving around, and he's got them in his head. That's how this is. Someone earlier today, one of our colleagues, described it as, if you were to lay it out on a wall, it would look like one of those serial killer plans with string attached with thumbnail, little pins attached to the wall and everything like that. It is crazy. It's extremely complicated, but I'll try and break it down. Primary concern, if you are one of these entities covered by CMS, is that the CMS rule is the one that applies. If you're covered by the CMS rule in one of your facilities, you do not need to look to the OSHA November vaccine mandate rule. That new emergency temporary standard from November does not apply if the CMS rule applies in your facility. The federal contractor requirements that came out maybe now 3-4 weeks ago that require all federal contractors to abide by the vaccine mandate, those do not apply if the CMS rule applies to your facility. So if you're covered by this CMS rule in one of your facilities, you do not need to worry about the November OSHA emergency temporary standard or the federal contractor standard. You might, however, still need to worry and comply with that June OSHA emergency temporary standard. And one of our good friends in the chat wanted me to emphasize that June OSHA emergency temporary standard still applies to those facilities that were covered by it. That June OSHA emergency temporary standard will likely, almost certainly, expire on December 21st. OSHA hasn't really taken any steps to extend it permanently. I'm surprised by that, but they haven't taken those steps. It's not likely to be extended. So for now, for the next 40 days or so, you'll be required to continue to comply with the June OSHA ETS and the CMS rule in those facilities. Keep in mind, however, that the CMS rule is facility-based. So if you're an organization that has a nursing home and a hospital, those are likely covered by the CMS rule. If you also have an assisted living facility, that's not covered by the CMS rule. And because that assisted living facility isn't covered by the CMS rule, then you need to look to the November OSHA emergency temporary standard and the federal contractor rule to see if you might have a vaccine mandate that comes from one of those areas. Jessica earlier in the presentation mentioned the office building. If you've got an office building where none of those people interact or go on site, they, in theory, may not be covered by the CMS rule. But for those employees who are in that office building, then they may still be covered by the November OSHA emergency temporary standard requirement, because you as an organization are larger than 100 employees. So the interplay between all these rules, again, is unbelievably complicated. It's something to evaluate and take some time making sure that you do have it all kind of in sight. I suspect we may get more guidance on this. There was a fair amount of confusion when the rules first came out a week ago. The White House clarified in some statements since then. CMS on their end very clearly said in their frequently asked questions, if you're covered by our rule, you're not covered by the November OSHA ETS or the federal contractor rule. So with that, I'm going to introduce our third partner. Carrie Claiborne has now rejoined us, and she's going to touch on some of the state issues that we need to consider here.
Hi, everyone. Sorry I'm a little late. I was going to ask, could you guys just repeat everything since I missed it? That would be really helpful. No, but seriously, I had some technical difficulties, so I apologize for that. But the state issues I'm going to talk about, for the main issue is that under the rule, it specifically states, which you may have heard that the other rules state this as well, explicit that it preempts contrary state or local laws. Where this is going to come into play most likely, there are some states, as we know, that have put local or state bans on mandates. This rule is intended to preempt or trump any of those local bans. And then also where this also has been a big issue for specifically a lot of healthcare providers is a right of conscience laws. So a lot of states, or at least a handful of states, have these right of conscience laws that some employees have chosen to use and to say, you know, they're going to object to getting the vaccine or even testing because it goes against their conscience. And a lot of those laws are pretty broad, which have made it difficult to implement any kind of mandate. The CMS rule is intended to also preempt those kind of objections. So unless, you know, a battle comes down the road legally, which I'm sure they will come, but the way it's written, you should be able to say, you know, rely on the requirements of the CMS rule despite any contrary state law. And then some other state laws that you're going to want to consider that the CMS rule really doesn't specifically address or preempt would be these examples we have listed. There will probably be others that we think of or you think of along the way. Paid sick leave laws. So for example, the rule does not require you to provide paid sick leave for people who get the vaccine or for adverse effects, but there may be a state law that does require paid sick leave for, you know, this might qualify for a paid sick leave requirement under state or local law. There may also be state or local laws that require you to pay for the cost of testing. Now, as I'm sure you guys know, and they talked about, testing is not a requirement under this rule or like an alternative, but in all likelihood, someone who has an exemption will probably have to do some testing. And so the cost of testing, if you do implement testing requirements, might be something an employer has to pay for under state or local law. And that's going to vary state by state. So it's something to consider depending on what states you're in. And then the last one we have listed is unemployment insurance. A lot of people will ask about this. Employees will ask whether, if they decline to vaccinate and then they they end up getting their employment terminated, are they then going to be eligible for unemployment insurance? This is going to depend on what state they're in and what state you're in. So it'll vary by each state. And then also it will depend a little bit on how you classify the discharge. So that's going to be, there's no clear answer. The CMS rule doesn't address that specifically. So that's going to be something to consider, and that will be a little complicated by state laws. And next.
So one of the things that that Carrie touched on and that I thought was interesting in the CMS rule was some of the commentary from CMS about preemption. It's not a surprise that the federal government says federal law prevails and preempts any state law that might be in conflict with what we're requiring. What I thought was interesting was a sentence in the CMS rule that said, any state laws that purport to give greater protection to employees are preempted by our federal vaccine requirement under the CMS rule. So for instance, the state of Iowa, within like 24 or 48 hours, passed legislation through the legislature and with the governor's signature that said, if you have an objection to the vaccine, even if it's not basically not religious, you can, under state law, avoid any employer requirement to get vaccinated. And the CMS sentence in the rule essentially said if a state purports to give broader protection to employees like the state of Iowa, that's preempted. And I thought that was somewhat fascinating. It's not kind of usual where the federal government says if you want to protect employees more, you can't do so because of this federal requirement. A fair amount of the comments, and we're now over 100, and again, we'll try and touch on them as we get to them. A fair amount of the comments are making respectful comments about the staffing crisis. It is a crisis, without a doubt. I mean, we just saw, I think it was today, that the greatest number of resignations occurred in the country than ever before, in the month of September, I think it was. It's a crisis. The policymakers at the federal level know that. They've moved forward with this rule and the other rules, despite knowing that, and it's something to manage around. I tell you, there may be flexibility and there may be room to work within these rules to try and address some of those staffing issues, and again, work with counsel to try and do so. The policymakers have decided that the staffing crisis is as it is, and they're still going to move forward with the mandates. Obviously, a lot of businesses and probably half of the governors in the country don't agree. So you've seen a lot of litigation in the last week. One question that we're seeing a lot, and a very kind of clear answer, the injunction or the stay or the freeze that is in place for the OSHA November vaccine requirements does not apply to the CMS rule. So the CMS rule is still valid, still in play. No court has said you can't or don't have to comply with it. It's still in place. You still need to move toward that phase 1, December 5th deadline with all those requirements. There are lawsuits that are challenging the CMS rule, and today I think another governor jumped on board with that. That's out there. I'd say it's not likely to succeed. It's possible that the OSHA rule is enjoined and doesn't go into effect. That's possible. But I'd say it's not likely that the CMS rule is either enjoined or that it somehow doesn't go into effect. And the reason for that is just the legal standard that these people who are suing are going to have to meet. For OSHA, OSHA needs to show there's a grave danger, and that gives them the ability under the federal law to implement these emergency rules. For CMS, they've tied this vaccine mandate to the conditions of participation or conditions of coverage, and they've got a lot more flexibility under federal law to decide what is and is not a condition of participation. So I would be shocked if there is an injunction that sticks, and I'd be absolutely floored if the CMS rule eventually does not go into, well, it is in effect, but is somehow stopped before December 5th. There's a ton going on. All of you have probably lost sleep over the last week because of these rules and trying to work out all these legal issues, policy issues, and practical issues. We have provided more in-depth thought leadership as a law firm. We've got a couple of the links here from our past presentations and webinars and things that we've done. So feel free to visit those. I mentioned at the beginning, there's a couple questions that floated in about it, so I'll mention it again. This is recorded. There's a little icon on your console that is, I think it's titled Resources. Yeah, Resources folder. So the slides will be there. You will be emailed a link to a recording of this webinar so that you can share it with all your friends and coworkers and colleagues. We do have, in addition to the thought leadership we've implemented going backwards, next week, we do have a webinar for the November OSHA vaccine mandate. But again, it's important to remember, if you're covered by CMS rule at a facility, you're not covered by that November OSHA rule. But it's complicated because you may be covered at one facility under the CMS rule, but not covered at a different type of facility by the CMS rule. And then at that different type of facility, you may be covered by that November OSHA rule. So lots of complications and fun, and maybe we can touch on a handful of questions in our last 5 minutes that are remaining.
Yeah, I was just going to add, Tom, to the last slide you had. I noticed there are a fair number of questions coming about how to handle the requests for a religious exemption, like who decides, how do you decide? And there was one question, like what would even be a valid exemption? And we do have, on the previous slide, there's a link you'll see here. I'll show you if I can. That there is a link to an article about that in more detail, which will probably be helpful. Of course, it's going to be a case-by-case basis to consider those requests. But there are, I think it might be helpful, like when you read that article or others about it, check in with someone if you need to on a particular situation. The like flurry of false and, you know, like I'm trying to think of the right word, but for these, there has been like such a high volume of requests based on religion that appear to be, you know, insincere. So it has gotten more complicated to sort through those, but there are legitimate requests that in the midst of all of that, you still need to be, you know, to make sure that you're considering them like we would have before kind of this COVID volume of requests.
And I'd tell you, there's a lot of healthcare facilities that implemented a vaccine requirement prior to the rule, right? And they have gone through all of these different nuances and intricacies of how do you do this. They have that expertise, and I'd encourage you to reach out to peer organizations that did implement those and get their feedback. We have counseled them and guided them through those questions. What do the policies look like? Who needs to review? What do the reviews look like? How do we deal with the religious one that we get that we know is cut and paste from some website that's out there? Those are all questions to work through, not only on the legal side, but on the practical business side too. If you get one of those cut and pasted religious exemptions, you need to think about that in the context of the entire organization, and you have every right and ability to do so. There are a lot of questions in the chat about, am I covered? Is this facility covered? The one I see in front of me now is our home and community-based services covered. There are some fairly clear answers about whether a facility is covered or not covered, but you want to get it right. So I'd encourage you to spend that time really getting into it and looking at it. The slides at the beginning, and Jessica mentioned it, they've got a list of 21 kinds of entities. And if your enrollment forms for Medicare, Medicaid list you as one of those facilities, you are covered. If you're not one of those facilities, the other thing to keep in mind, and a couple questions are, what about if I'm a self-employed physician, am I required to get the mandate, the vaccine under this mandate? If you're in an assisted living facility and you've got staff in assisted living facilities who aren't required to get the vaccine under this rule, do they have to? That's complicated because if you are a physician that is doing locums work at a hospital, you might not, as your own LLC, be required to comply with this rule, but that hospital needs to require you to comply with the rule. And if you want to continue to do locums work at the hospital, you're going to have to get vaccinated or give an exemption. That assisted living facility that might not be covered, but every week gets together with the nursing home staff who are covered, then all of those assisted living facility employees get the vaccine under the rule. Living facility isn't required to get the vaccine. So it is that true web of all kinds of complication. And someone in the chat said, it's nuts. It's nuts. But we're here to help. Happy that the webinar could serve some value for you. Again, just a couple closing notes. You will get emailed a copy of the slides as well as a recording of the webinar. We are pending approval for education hours, so watch for that, and certificate of attendance will come out. There will be a survey at the end of this, so we would please ask and encourage you to take a minute or two to fill that out, because we're going to continue to provide this kind of thought leadership going forward and would benefit from your experience and your thoughts moving ahead. So with that, thank you, Jessica. Thank you, Carrie. Thank you to all those who joined, and we'll see you soon.
Thanks.